Urinary system. A. Urinary symptoms. Urine is formed in the kidneys and start in the bladder until it is passed or void. Um, Patients maybe say, I have some pain when I pass water. I have some pain when I pee. Doctors maybe say, uh, are you having any trouble with your waterworks? Uh, Doctor, are you having any trouble with your waterworks? Mr. Jones, well, I do seem to have to go to the toilet more often than I used to. Doctor, how often is that? Mr. Jones, it depends, but sometimes it's every hour. It's every hour, or often more often, or even more often. Doctor, what about at night? Do you have to get up at night? Mr. Jones, yes. Nearly, nearly always 2 or 3 times. Doctor, do you get any burning or pain when you pass water? Mr. Jones, not. No, not usually. Doctor, do you have any trouble getting a start? Mr. Jones, no. Doctor, is the scream normal? Is the stream normal? I mean, is there still a good strong flow? Mr. Jones, um, perhaps not quite so good as they used to be. Doctor, do you ever lose control of your bladder? Any leaking or dribbling? Mr. John, well, fed ups, a little dribbling from time to time. Doctor, have you have passed blood in the urine? Mr. Jones, no, never. Common urinary symptoms and their definitions. Frequency, frequent passing of urine. Dysuria, burning, and scalding pain in the urethra when passing urine. Nocturia, urination at night. Urgent need to pass urine. Is stancy, difficulty starting to pass urinary incontinence, involuntary passing of urine. Hematuria, microscopic blood in the urine. B. Urinalysis. Urinalysis is the analysis of urine. Simple screening test of the urine is carried out with reagent strips, for example, clinicistics, for the detection of glucose. More delayed test and carried out in a laboratory on a specimen of urine. Typical specimens are a midstream trim specimen and a carotid specimen. Microscopic examination may reveal the presence of red blood cells, pus cells, or cast cast are solid bodies formed by protein or cells. Plus signs are used in case notes to indicate abnormal findings. A small amount is described as a trace. For a large amount, the words gross or market can be used. For example, gross hematuria when there is norrin. The word nil is common. There was no sugar. There was no sugar. A trace of protein and was gross hematuria.